You're listening to Plug Into Health with Prevea Health, exploring healthcare topics that matter to you, the latest developments in health and medicine, and the inspiring stories that emerge from Prevea Health, our partners, and the communities we serve. Thank you for joining us for this episode of Plug Into Health. October is Breast Cancer Awareness Month, and the statistics really make you pause when you hear about the impact it has on women. The average woman's lifetime risk for breast cancer development is 12.6%, or approximately 1 in 8 women. There are more than 6,300 new female breast cancers diagnosed annually in the state of Wisconsin, and more than 360,000 diagnosed nationally each year. And lastly, there are more than 42,000 breast cancer-related deaths annually. I'm here today with Prevea Health President and CEO, Dr. Ashok Rai, and Prevea Breast Surgery Nurse Practitioner, Lauren Prokes, to talk about Prevea's I Found a Lump program. This was created specifically to help get women answers quickly for when they find a lump in their breast. Thank you both for joining us.
Thanks for having us.
Lauren, I'd like to start with you. Before we dive into what the I Found a Lump program is, I'd like to start with how most women get to that point where they've discovered a lump and the importance self-breast exams play in all of this.
Yeah, there's lots of ways that lots of stories for what a woman has for how she shows up in my office. But it all starts with some kind of exam. She did some kind of exam at home and she found a problem, a lump, something was going on. Now, breast exam is one of those things that kind of goes in and out. Do we teach it? Don't we teach it? Do we call it self-breast exam? Do we call it self-breast awareness? Regardless of what we're doing, women are doing exams on themselves. And so it becomes this important thing that we have a discussion about self-breast exam and how important it is, so that women kind of understand what they're looking for, what would be normal, what would be abnormal. When a woman comes in to see me in the office, what I often talk about is kind of that anatomy of the tissue. I give them that basic anatomy. I give them what the distribution is in the breast. I give them kind of the fluctuations throughout the month and what that would look like. So they have this systematic approach to how to know what they're looking for. Really what I tell women is we're not looking for cancer when we're doing a breast exam. We're not even looking for lumps. It's actually some body awareness, keeping ourselves familiar with our own tissues, that if something were new, something we're changing or developing, that we'd recognize that as different for our own self and we would know to call. Typically, what I recommend is that women are doing them monthly, that they're doing them preferably in the couple of days to 2 weeks after they've had their period. That's when we're going to have the lowest amount of hormone influence on that tissue. That's when the breast tissue is going to be more at its baseline. And so I teach them about what they're looking for and how to kind of approach that.
Good stuff. Thank you for that. Let's talk a little bit more about the I Found a Lump program. And Dr. Rai, I want to go to you on this. I understand the creation of this program is very personal to you. What inspired you to take action and get this program going?
So a little while back ago, I was boarding an airplane, got a text message from my brother-in-law that my sister-in-law found a lump. And there's some family history of breast cancer, so it was obviously very concerning. It's a Saturday morning. Like I said, I'm flying out of town. I was able to shoot a couple quick text messages to team members in the radiology area and in our breast department to get her in on Monday, get an ultrasound, get a mammogram, get a biopsy, had pathology results by Wednesday. Thankfully, it wasn't cancer, so we were really blessed by that. And then when I got back into town, I just met with the team and said, thank you. It was great work. Did she get all of this because she's my sister-in-law, or did she get all of that care because I know who to call and we had the availability? And it really was the latter. Like we have the ability. We could do this every day. Just people don't know how to navigate the system. And a lot of it, and I've said this a lot, is healthcare is really complicated. And you don't want to try to figure us out when you really need us. We got to make it easy. What's that easy button? We talk about that a lot when it comes to access. So working with our breast care team and working with our imaging team, I really wanted to make it super easy that when somebody finds a lump, they don't have to text the CEO of a health system. They can click a button on our website or, have a way to dial a 1-800 number and get it all taken care of for them and not have to wait. because I think thinking you have cancer is one of the worst things you can go through. Thinking one of your children has cancer, one of your family members has cancer, or if you have cancer, and you want answers right away. And sometimes we have to wait because of biopsies and pathology, and that's just, how long it takes tissue to be prepared to look at it. But even that 24 hours is excruciating. And we wanted to really take that tension away from our community. So that's where Found a Lump came from.
Dr. Rai, thank you. Lauren, there's something that you said before that has really resonated with me, and I know it's resonated with others, and that is when a woman finds a lump, for them, it's cancer until proven otherwise. Talk about that mindset and what the program does to help provide women answers quickly.
Sure. I think we hear about breast cancer all the time. We would not call breast cancer a rare disease. And I think that we all, we hear about it so much, and it's kind of in our face all the time. Somebody always has a friend, a family member, a coworker, or many friends, family members, and coworkers who have had breast cancer. So it's not something that is once in a while you hear about it. We hear about it all the time. And so when a woman finds a lump in her breast, it's very scary. That sense of urgency is really high because that's what we hear about all the time. And there isn't really a great way to know, is this a cancer? Could this be a cancer? Is this what a cancer feels like? I think often our minds go to the worst possible until we get the answers to get backwards. And so the I Found a Lump program really became kind of like a game plan for our patients. Not I found a lump, what am I supposed to do? I found a lump, I'm going to pick up the phone and I'm going to call. So it really became something to help decrease that anxiety on the individual who's calling, to try to get them from the time they found that lump to the time, or to getting some answers fairly quickly.
Let's dive more into that process. What does it look like from start to finish? I've found a lump. What do I do, and how do you help me through this program?
Sure. So when a woman finds a lump for the first time, she just has to pick up the phone and call. We've got a spot on hold. We're there to get her in right away when she calls. No referral is typically needed unless an insurance company tells them they have to. But women can call directly to the breast surgery department. We'll get them in to see them. First, we do a thorough clinical breast exam. We measure the lump. We measure kind of the distance in the breast that it is, where it's located. We mark it. We send them over to the breast imaging department. We get a mammogram if it's been less than 6 months since their last mammogram, and then we get an ultrasound. If there is something there that needs something like biopsy, for instance, it's read right away while the woman is still at the department. The radiologist will give their recommendations, and then our breast imaging staff will sit down with that woman, and she'll talk about what the recommendations were and help her to get set up for that biopsy before she leaves the clinic that day. If it's something benign, I typically will call my patients back, or if I'm running around, I'll have my staff call them and say, hey, Lauren, took a look at your imaging. Everything looks good, but here's what our plan is going to be for the future, so that the woman knows what to expect, what the plan is at every step of the process.
Can you talk a little bit about our breast surgeons? We know that, in many cases, a patient's anxiety is decreased and the lump may not be anything to be concerned about. But in other situations, a patient may need breast surgery. What resources do we have available at Prevea to provide that service?
Sure. Unfortunately, sometimes those palpable lumps do end up being something like a cancer or something that may need surgery, maybe not even a cancer. Right when that pathology comes back, typically our breast imaging nurses look at it right away, and then they call the patient and give them a plan right from the time that pathology comes back. Let's say it was something like a cancer. We want to really decrease the amount of time that the woman spends looking at that report in her MyChart and having to think about it. So our staff calls right away, and they give them 2 appointment times available. Here's an appointment, the next appointment with Dr. Huang. Here's the next appointment with Dr. Ahmed, and let the patient choose. Now, Dr. Huang is a fellowship-trained breast surgeon, which means that he did that extra training after residency, that couple extra years of really honing in on the breast tissue, benign and cancerous diseases of the breast. He has a real passion for treating diseases of the breast. We also have Dr. Humaira Ahmed. She is a general surgeon who does breast surgery. She actually spent a lot of time during her residency doing a lot of breast surgery. So she has all that time, and she carried that through into her surgical practice once she became a practicing physician.
Dr. Rai, what is it like for you to hear how this has all come together and this plan has come to fruition and how we're serving our community in this way?
Obviously, the ultimate dream is that we wouldn't need it, that we would have a cure for cancer every day. But till we have that, taking away fear, reducing that time of worry, it feels great to be able to do it. Obviously, my family had an awesome outcome here. We want to make sure that every family has that awesome outcome. But if we do find something, that we get that patient taken care of right away. The fear of waiting is what I found a lump was there to try to treat. But treating the breast cancer itself, having great partners like Dr. Ahmed and Dr. Wong available to us, to have Lauren available to us, to have that whole staff, the imaging staff, the radiologist, all in one area, and to rapidly get that diagnosis, that's an investment directly to our community. And we wanted to make sure that people could access that without trying to figure that out. Like you were saying, you get that message in your MyChart or your My Prevea app, and you see the C word, and you see cancer, and everybody's heart rate goes up, you're on the phone, there's tears being shed. We want to make sure that we have a plan for you right away. You're not waiting a week or 2 weeks to see somebody, that you're waiting a day, and we're getting you in. We've got a plan for you. You have options to look at, and you leave, the fear's still there, but maybe a little bit less.
Thank you. Thank you, Dr. Rai. Thank you to you as well, Lauren, for joining us on this episode of Plug Into Health. A big thank you to our listeners. If you'd like to learn more about the I Found a Lump program here at Prevea, give us a call at 920-272-3350, or you can visit our website at prevea.com. You've been listening to Plug Into Health with Prevea Health. To learn more and to submit ideas for future shows, please visit prevea.com/podcast. And please remember, the information provided in this podcast does not constitute medical advice. It is not intended to replace interactions with your healthcare professional. And if you are concerned about your healthcare, you should consult with your healthcare professional. You can learn more about Prevea Health at prevea.com. Thank you for choosing to plug into health with Prevea Health.